My name is Shanya Mapp. I'm a student presently attending Troy State University out of Augusta, Georgia, and I am pursuing a Master's of Degree in Counseling and Psychology. I am taking the course of Marriage, Family, and Sex Therapy Counseling under the leadership of Dr. Joe Holt. This course introduces and surveys the theories and practice which have developed to support the counseling of couples and families. It helps counselors develop a system view of human behavior as a complement to individual therapy that is the common model for dealing with people and their problems. Family therapy is a branch of psychotherapy that treats family problems. This is an example of family therapists. Therapists will be qualified and experienced mental health professional, psychiatrist, psychologist, or psychiatric nurse, or occupational therapist. In addition, they will either be qualified as family therapists, training to become family therapists, or gaining experiences of working with families to enhance their clinical skills. If they are not qualified as family therapists, they will be under the direct live supervision of a qualified family therapist who will also participate in the team. Genograms was first developed and popularized in a clinical setting by Monica McGoldrick and Randy Gerson through the publication of a book titled Genograms. Genograms is created with simple symbols representing the gender with various lines to illustrate family relationships. It is used to study and record relationship patterns between family members and the individual characteristics that make up these patterns that occur. Genograms will be helpful to family therapists to make an appropriate assessment of those relationship problems and patterns and where interventions may be needed to assist the family to reduce their dysfunction and or problematic situations that are brought into therapy by them. This is an example of a family genogram and the symbols that they represent. Family therapy can be short-term treatment, usually for several months in length, with a focus on resolving specific problems such as eating disorders, difficulties with school, or adjustment problems to bereavement or geographical relocation. It can also be used for long-term or intense restructuring of severely dysfunctional families. I would like to introduce to you some of the pioneers of family therapy. Nathan Ackerman, Virginia Stratier, Gregory Bateson, Theodore Litz, Murray Bowen, Salvador Minuchin, Carl Whitaker, and these are just some of the family therapists who made a great contribution to organizing family therapists. Family therapy does not take sides or blame people. It only provides simple answers to help individuals understand how the difficulty of problem arises and then develop goals to assist the family in discovering its own resources of new ways of learning how to relate to one another. Over an average, family and couples are seen from 5 to 8 times or from 2 to 4 weeks intervals over a period of 3 to 9 months. The therapist and team will always be open to discussion about whether the work they do and the family are doing is being helpful or not. And if it's not, it could come up with ways to change whether or not another kind of therapy may be more useful. At the end of the therapy, the therapist will offer a follow-up review session after 6 months, which sometimes most families appreciate because it helps them be able to determine whether or not the therapy session has been helpful to them, as well as helping them solve their problems as they go through their day-to-day lives.